Today I am going to discuss about the polycystic ovarian disease that's very common nowadays in our society because of change of our habits. So normal cycle, there is a one ovum is coming out on the 14th day of the period. So we are getting our period in 28 days cycle. Once we talk about the polycystic ovary, means multiple follicles are forming in the ovaries, and multiple follicles they are not going to rupture and not coming out in time during the time of ovulation. So that's causing the delayed period. Once the delayed period is there, it means some hormonal imbalance is there. So in that case, the polycystic ovary, they can present either young girls, they come with the delayed period, very scanty period, like they are getting period in 1.5 month, 2 month, 3 month, or sometimes they are not getting only once they take tablet, then they get the period. So they can present with the delayed period. और मैरिड लेडीज दे कम विद द कंप्लेंट ऑफ स्टेरिलिटी कि उनको 1 साल हो गया है, 1.5 साल हो गया है, 2 साल हो गया है, वो बच्चे के लिए ट्राई कर रहे हैं एंड दे आर नॉट गेटिंग प्रेगनेंसी. और पॉलीसिस्टिक ओवरीज कैन प्रेजेंट विद द कॉस्मेटिक पर्पज ऑल्सो बिकॉज यूथ गर्ल्स दे कम with the complaint of overweight in the sense this obesity is hormone dependent. So even after doing diet, even after doing the exercise, weight is not coming down. That's the common problem. And they can get the lot of burning acne on the face. They can get lot of hair growth on the upper lip, on the chin, so and side locks. So this hirsutism, excess growth on the face, acne, overweight, sometimes they get the pigmentation in the axilla and neck. So these all symptoms they come with the cosmetic purpose. So we should know why the polycystic ovarian disease is causing all these changes in the body. So as I said in my first video, normal cycle estrogen progesterone hormone is there that maintaining the cycle for 28 days. In polycystic ovary, the androgen testosterone hormone become high. Testosterone hormone is male dominating hormone that is supposed to be more in the male, but in polycystic ovarian disease, because of the ovarian stroma is secreting lot of androgen, so they are having more male dominating hormones, and they get all these symptoms because of that only, like all the female symptoms, not having period, having lot of hair growth on the face, and acne, and infertility, and delayed cycle. So polycystic ovaries we can diagnose with the history also कि patient is not having proper period, having infertility and all the cosmetic purpose as I said. And for the diagnosis we have to do the baseline sonography on 2nd or 3rd day of the period. So that time in the both ovaries we get lot of multiple follicles in the both ovaries. So that's one way of diagnosing polycystic ovary. Second way is doing the hormones test. So once we are doing the hormones test on 2nd or 3rd day of the period, then there is a disturbance in the hormones, and all the testosterone and male dominating hormones are high. Many times they are associated with the thyroid also. So these all are the physiology that can be diagnosed with the history and the investigation. Now depend on the treatment part. Treatment start from the hormones treatment according to the patient blood report. Then we have to advise them hormones at least minimum for 3 months. Now hormones treatment also depend ki whether she is married or she is unmarried, whether she want pregnancy, she don't want pregnancy. If the young girl she is not married, then we have to give different line of treatment to maintain the hormones. If she is married and having the infertility, not getting pregnancy, then we have to give the different line of treatment. So that minimum we have to give 3 months. And we have to assess whether she started ovulating or no. Ovulation means अगर हमारा हार्मोन्स का लेवल मेंटेन है, infertility patient है, अगर हमको ovulation हो रहा है, means this dose is sufficient and she can get the pregnancy. Even after getting pregnancy, these patients they are very common to have the habitual abortion. उनको क्योंकि हार्मोन्स का डेफिशिएंसी होता है, इसलिए बार बार उनको अबॉर्शन अर्ली प्रेगनेंसी में होने के चांसेस रहते हैं 2nd 3rd मंथ में. तो जो ट्रीटमेंट हम हार्मोन्स का उनको विदाउट प्रेगनेंसी शुरू किया है, दैट ट्रीटमेंट वी हैव टू कंटिन्यू टिल 4 मंथ ऑफ प्रेगनेंसी, सो वी कैन मेंटेन द हार्मोन लेवल. आफ्टर 4 मंथ प्लेसेंटा डेवलप हो जाता है तो हार्मोन्स बनाना शुरू कर देता है. That's the one line of treatment. But we should know all the PCOD patients, they are prone to have high blood pressure, diabetes, premature delivery during pregnancy also. So all the PCOD patients, they are prone to have infertility, early pregnancy abortion, and midterm pregnancy. They can get all this complication of high BP, diabetes, and delivery related complication. So we should take care, especially as a high risk patient who are having the PCOD. The other things come for the cosmetic purpose. So whatever the acne are there, we should not try to squeeze them. We have to maintain the hormones level first, and then we have to advise to the patient ki just don't use much of cosmetic, just clean your face with the lukewarm water and mild soap, so all the holes are open and chances of acne will come down once the hormone level is maintained. Regarding the hirsutism, this hair growth on the side locks, upper lip and chin, we have to first maintain the hormone level, and then for the hair remover, either we have to use the laser. That's the best line of treatment in today's scenario. Otherwise, they used to go to parlor doing the bleach, they are doing the just threading, but these are the temporary thing. Permanent, after control of the hormones, they should go for the at least minimum 6 month laser therapy. Every monthly once they have to go for the sitting, so it should go out permanent. So that's the part for the cosmetic purpose, what problem they are having. In future, these ladies who are having the PCOD, they are prone to have high blood pressure, diabetes, high cholesterol level, more of cardiac problem after 35 years of age. So in childhood or adult ladies who are having this problem, even in the future, premenstrual, premenopausal time, they have to take lot of care for their weight, BP control, diet control, so they should not have the diabetes and hypertension in the elderly age. The other point, for all the PCOD patient, we should know that there is a insulin sensitization is there in their blood. So because these patients, they are having, as I said, they are having hormonal deficiency, and all hormones are fat dissolving hormones. So we have to tell them to do the diet control. They have to take less of fat, less of carbohydrate, and they have to do at least an hour exercise. So diet and exercise and medical treatment, all three has to work together. Once they will think of, I will just take the tablet and I will be okay, it never happens, because they have to reduce their weight. Weight loss is one basic line of treatment for the PCOD patient. So this is, we should know what PCOD is, why it is, what are the symptoms and diagnosis, and how we can treat in different part of life. Sometimes PCOD is very resistant and ovaries become very thick wall. Then we have to do the laser operation, laparoscopic ovarian drilling of this patient, and we have to open the ovaries if they are not responding to the hormones treatment. But that's after trying 3 to 6 months. Then lastly, if she is resistant PCOD, not responding to any treatment, then we have to operate that and do the laser operation. So this all thing is the baseline about the PCOD. So all the PCOD, what I said, all the young girls should know about their own body, and anybody is having all these type of symptoms, they can consult to their family doctor and start treatment after diagnosing it. Thank you.